Greetings again. This is Dr. Bill Wyatt with the American Orthodox Society, and we're going to discuss a case here. This is number 5 of the different cases. We're also taking out lower 6-year molars on this case too, but this is not going to be the right thing, the only thing that should be done with this case. He has too much vertical length of the lower third of the face, and then removing the 6-year molars will not reduce the facial height in the lower third of the face. So you'd have to go in and do the actual surgery in this type of case, where you go in and shorten the maxilla, which is a considerable amount of surgery involved in treating the case. But this young man refused to do that. So he said, if you don't do what you can do, I'm not going to do anything. So we went ahead and treated him by removing the lower 6-year molars out. But it is not adequate for taking the lower third of the face down. And you can see that as we treat this case at the end. We're still got too much vertical height, though we corrected the class 2 problem in going out to do it. So let's stick with us here and see the different things that we would do here. Now, he had a pretty bad class 3 problem, but we can correct the class 3 problem, but I can't reduce the height of the vertical height of the lower third of the face. It's going to still be too long in there, but he, as a man, can put up with that if he gets the teeth straight. So watch this case do as we go. Now this is the class 3. You're going to have to put that in there. In other words, we're going to move this back, but not only that back, but we're going to move this forward some. And do it'll be like a an upper and lower jaw surgery, and all of these are that way. And this is where I want to find out about. Now both the cuspids are fitting together. The upper cuspids are too far back. Well, we're going to advance this to some extent, and we're going to bring this back by some more. And you bring it back, and you're going to eliminate the lower 6-year molars to do this. So here we go. Now here is the lower 6-year molars removed. And if this works, then they can do this method of correcting class 3s, and it's very stable. Because you're advancing the maxilla, and a lot of these cases need the maxilla brought forward in nearly every one of them, as well as the lower jaw brought back to some extent. All right, we're going to show now. You can look at him here. He is definitely a class 3, but he's got too much length to the face there. Really, you'd like to stop the facial height somewhere back in there where it's be about like that. But you cannot do that by taking the lower 6-year molars out. I don't know any way to lower that down. So let's go through the case here. That is obvious what's wrong. It's got too much lower face height there. And he just said if you can't do what you do, he wasn't going to do. I guess he had probably gone to somebody and asked him about it and found out what the surgical expense would be, and said that he couldn't handle that. So he said, if you don't do it, I'm not going to do anything with it. Just leave it alone. And so I told him we'd go ahead, but we could not accomplish what I would like to do if I were correcting something to do everything we could do it. So here we're doing, we take the 6-year molars out, and you can see they're gone here, same way, and we have to jump the bite now, so we put a bite plate out here, a bonded acrylic plate that'll allow us to come across here. And now this is gonna, we'll get it across, we're gonna take all that off. We could have put some blocks on here and squished it down a little bit, but really correcting it that way would be very difficult. All right, so we go through the upper teeth now. We'll come in as we brought these teeth down, and this would come up some, and that it keeps that from lowering this vertical height of the face. And so now we level the upper out in here, and you'll notice the different angles. We see this tooth right here is going up. We put a kink in this archway like that, and that tends to make the roots go back in that direction. You can see if we've corrected that. So all of these have several other orthodontic things wrong that you try to do when you're doing the case. Now we'll close that about part of the way, and I've shown you how you see that little look of deal here. As we're bringing this forward, we're bringing the roots of the teeth forward also. You don't just tilt the mold over, you have to bring it forward bodily. All right, here we're getting closer, but we're getting the chin back and bringing this out a little bit. But we never do get it out exactly where we want it. Now, that's a bad picture, I'm sure. Did his eyes open here, or he's got them halfway closed. But I think we've got the teeth over the line now. Now we're going back. Now, if we had a good way to lower this vertical, now if you were doing this orthodontically, and I scrubbed in on those, you take the whole maxilla loose and trim the bone structure around where the sinuses are. You just practically do away with it. And just bring that up, and you can close that vertical down. All right, we're coming forward to this. We've got this is just a omega, but the wire goes down like that. And so we're pulling that forward, and you're going to close that up. This is more efficient if you do like this, and then come off, and now tie from there back to the back, and that'll bring these roots down and level them out. We still did that here. All right, we're getting pretty close. All right, here's 3 of 93, and we've got these up, but these are not tilted over now. Look at them. We're bringing them forward bodily. They're carrying them forward bodily. Now, if you needed more advancement of the maxilla, you could put pins in these teeth back here down in the bone, bond them to that. This would go back, and then as you brought the rest of this forward, this would come, and then you could bring the upper jaw further out if you needed to do them. So here we'll look at the x-rays. This is age 22 and 6 months. And this is 1991, I think, that we were going to be doing this. And here it is in 94. So we have brought the teeth back underneath. Let me look at that. You see the lower teeth are out in front of the upper. Now as we go back with that, we brought the roots of these teeth back too. See, you're not sitting out here like that. We brought that back, and so we're back in here, And this now is in virtually class 1 relationship. And here we took a, see, this motor's bad anyway, so we took this out right here. He has wisdom teeth. Don't try to do this if you don't have the wisdom tooth back there, because you're going to take this out and you're going to bring these teeth up to this area right here and close this, and you watch, we'll bring that in and those teeth will be parallel. Now we're bringing them back, and I had the arch wire coming like this with an omega, but this went down this way. As we're pulling that, closing that from here back to there, that'll tend to bring these roots forward with the crowns. So you can see the teeth are still hitting right here. We're not just tilting that tooth over. Now it's just about to close, and there's a pure Panorex X-ray. All right, looks like we got these roots of this tooth a little too far forward, but that'll level itself out here. But you see, this one looks pretty good there as we come around with the whole thing here. But we did not get this space between here lower like we would like to have finished the case out. Now he's aged 25 years at this point. Now the teeth are just about together. Now here is 93, that's just part of the way finished. 93, we're just about through. So we started, I think, at 91, and we got it just about through 93. Now, I showed you when we started out, we put these two dots over. That puts the cuspid in place where it should be between the lower cuspid and the first bicuspid down here. That brings us out, bring this lower tooth in front of the upper tooth right there, like that. All right, let's get on through here and show you. We've been through this on so many times. If you're getting tired of looking at this thing. Now we've pretty well finished him. I put the teeth down low here, and you can do that. You just hardly, you don't see much anything down here. Now we're going to bond these teeth together, or we should. All right, yeah, we've got a 3-to-3, and we bonded on this keratin here. Now these are the second molar, wisdom tooth, and that tooth is straight up and down in there. We didn't tilt it over into the hole. We brought it forward bodily in doing that. And though we've corrected the chin being out here, we brought this out to some extent up here, but there's too much height in the facial structure. And there he is as we finished. And there's his smile. Now he can get away with that as a man. This isn't bad. His chin's not out there that much further. But it really, if you could have closed this down, you would have his chin less forward, or you'd have to bring the maxilla a little bit further out to do that. It's a bad Panorex or bad picture here, but there's the upper teeth out there now, and that's in the right position. Now that's the teeth after we, this is 94, that's after we treated it. So, and the point I'm trying to bring across is that many class 3 cases can be treated by simply taking the first boulders on the lower arch out. And if you, let me go back here and get this, that doesn't see. And to correct that, we bring this back a little bit. My dot thing is going haywire here. And, all right. In doing these cases, you bring this back some if you need a bit more, which probably we should have done is given him more upper arch space and it would still look better. So you put pins in these and bond this tooth here. Then these don't move back hardly at all. And you bring these forward and the upper forward too, to give them more vertical height to the face. So if I'm off anywhere here, I didn't give him this much further out. I ought to have made the maxilla come forward more and it would look better because it'd be hard to shorten. Now you couldn't come in and do a genioplasty and take this back a little bit. In other words, I don't know that that'd be too good either. Well, I think this would have looked better if we'd have brought a little more of the upper forward. So if we'd have pinned these teeth down here and you're wearing elastics up in this area and you pull this forward and you got your molars back in here, you got to pull them forward and keep this from going back too much. You can change the whole facial structure. So thank you for watching them. And I want people to check these out and see if this would not be a feasible way to do about half of the class 3 cases, or maybe even more, and without the surgery. Now, the old surgeons won't really want to do that, but if you were having this done and watch the double jaw surgery, you'd be glad to, not to say in triple. It's genioplasty, advancing the mandible and bringing this part out here too. Or not advancing the mandible, but shortening the mandible. All right, I'm going to close out and say, I want you to watch our channels. We are loaded down with channels, and we have a lot of videos on here. But if we can change the way the whole world does class 3 corrections by just simply taking the first molars on the bottom arch out, and then how much you pull this back. If you don't want to take it back much, we want to take molar correction by bringing the upper jaw forward, then use this, hold it off, and bring this forward. Bring the upper jaw forward by bringing the lower teeth back a little bit, and you can nail them down there with a tad. So you pull this out here and hold it and bring the upper and this forward to do that, and you would get most of the correction in the facial structure would be a fuller deal. So thanks for watching, and I'm going to say goodbye, and we're going to do 1 or 2 more of these surgical cases. The non-surgical cases. So I'm going to stop here.